Hello everybody, my name is Sarah and I also have Brianna with me as well for the prostate cancer presentation. So what is prostate cancer? Prostate cancer is a slow-growing tumor which is often stationary in the prostate. Prostate cancer is the second leading cause of cancer deaths in men and is most common in African Americans. So the physiology of prostate cancer, the prostate gland lies inferior to the urinary bladder and surrounds the first part of the urethra. The ducts of the prostate carry the secretions to the urethra, and the secretions, which are slightly acidic, help to neutralize vaginal acidity while enhancing the sperm motility. The prostate gland consists of smooth muscle that contract during ejaculation via signals from the nervous system. So here on the left side of our photo is the normal physiology. So as you can see in the prostate gland, there isn't any cell buildup or anything like that, whereas in the pathophysiology, there is a buildup of cells. So in the pathophysiology, the surrounding tissues, most commonly the urethra, is impacted by the continuous growing prostate tumor, which can affect the client's ability to urinate. So prostate cancer shows similar manifestations as benign prostatic hyperplasia because it distorts the urethra and the client would have troubles urinating as well. So in this picture here, our second one shows the abnormal cells growing. So sometimes they can even burst out of the prostate and move into other parts of the body as well. So the exact cause of prostate cancer is unknown, but as of right now, they know that prostate cells become abnormal. So the abnormal cells continue to live when usually they would die. So the formation of the tumor is from a buildup of the abnormal cells. In the cell's DNA, mutations occurs, which causes the cells to divide and grow rapidly compared to what the normal cells would do. The abnormal cells may also spread to other parts of the body, which I showed you in that previous picture, how they can burst out and spread. Some factors that may influence prostate cancer would be a family history of prostate cancer, history of STIs, high-fat diet, and it may also worsen with advancing age. And Brianna's going to take you through the signs and symptoms.
Hi everyone. So for signs and symptoms, we have frequent urination, nocturia, which is urinating during the night, painful urination, hematuria, which is blood within the urine, hemospermia, which is blood found within the semen. Signs and symptoms can take a varying amount of time to develop. The patient can remain unaware that they have prostate cancer until the tumor has grown big enough to inhibit normal urinary function. Treatments for prostate cancer include chemotherapy, hormonal therapy, radiation, as well as other treatments such as cryosurgery and other surgical procedures. Cryosurgery is a procedure using liquid nitrogen or carbon dioxide that freezes and destroys the abnormal or diseased cells. And a couple surgical procedures we found were suprapubic prostatectomy, which is the removal of all or part of the prostate gland, as well as transurethral resection of the prostate, which is a procedure that is used if the urine flow has become restricted due to the client or patient having an enlarged prostate. Using a rectoscope, it is inserted through the tip of the penis and into the urethra, allowing for urine to flow. Current research. So Dr. John Lewis is an experimental oncologist that is out of the University of Alberta and is head of a research team that has been utilizing nanotechnology and video microscopy to progress in creating a less harmful medication to help determine the variances between patients that is keen to result in a treatment of prostate cancer that is more specific to the individual. So instead of treating patients generally with the same type of therapy, the same amount of time, the treatment would be more specific to that individual. They have also created what they've labeled tumor glue, which uses an antibody that makes the stickiness of the tail of the cell and blocks that cell from being able to move, which inhibits the cancer cell's ability to be able to spread outside of the prostate. And quiz time. Good luck! Okay, so for the answers, prostate cancer is the second most leading cause of death in men. Number 2, the prostate gland consists of smooth muscle. For number 3, it's true. For number 4, it's false. Chemotherapy is an option. And 5 is true. And here is our visual summary. And our references. Thanks so much, guys, for watching.